Welcome everyone, and thank you for joining us for today's Professional Development Series session. My name is Amy Page. I'm a Quality Assurance Specialist with the Center on Early Childhood Quality Assurance. Today's webinar is the session in the licensing series we are hosting this year. I want to take a moment to acknowledge my colleagues here at the Quality Center that have assisted with today's session and are also supporting the broadcast today. Thanks go out to Tatiana Garafola, Shannon Smith, and Christy Lewis. Today's session is being recorded and will be posted to the center's website along with the slide deck after they've gone through the required remediation process for accessibility. Due to high attendance today, all participants are in listen-only mode in order to reduce any potential feedback or unintended background noises. We will have some polling questions in just a moment. So we encourage you to be involved with those and also to use the chat feature in Zoom to engage as we go throughout the presentation. You can do that by clicking on the little chat button at the bottom of your toolbar on the Zoom screen. And if you have any trouble during the session, please reach out via that chat feature if you're experiencing any technical issues. Just be aware that we may have limited capability in what we can address as far as issues go while the webinar is running. We'd like to take just a little bit of time to find out a little bit about everyone on the call today and then review the agenda together. So if we can go to the next slide, it looks like some of you are already responded to the polls. Some of you may not be seeing the Zoom polls in that have popped up onto the screen. That could be because the version of Zoom that you're running just needs updates. So don't fret if you don't see them. The information that's being asked is just to share what state, territory, or tribe you're joining from today. And then the second question asks how long you've been involved in childcare licensing or the early childhood system. And there's choices there for less than 1 year. If for some reason you're not able to see the polls, feel free to drop in the chat like some of you are, where you're from. We're going to give everybody a minute. The third question, you may have to scroll down a bit on the polls for those of you that can see them. And it just asks what your current role is. Frontline licensing staff, a manager, maybe a licensing administrator, technical assistance provider, or other. And then it just the final question is just short answer. What does quality assurance mean to you in your work? So we're going to give everybody just a moment to respond to those. And again, not to worry if you do not see the polls. This is the only polling that we will have for this session. So if your version isn't launching it right now, not to fret at all. Okay. Looks like we have a pretty wide range of experience, but respondents have all said we have from less than a year all the way up to 10 plus, but quite a bit of experience on the call because almost half of the participants that have responded have 10 plus years of experience. So that's great. Glad to have all of you veteran staff on the call. A little over half of you are frontline licensing staff, so that's great. It was really our whole intention with this series this year to reach license. And again, it looks like from the chat that we have quite a few people that can you all hear me okay now? Someone let me know.
Amy, we can hear you now. You went out for a little bit.
Sorry about that. Okay. Hopefully the connection stays stable now. My apologies. Just a quick recap on the poll. Looks like we have over almost half the people with 10+ years of experience, so quite a bit of experience on the call, and 52% are frontline licensing staff. So in order to not test the connection, we will move on from there. Our presentation today is on effective quality assurance strategies and licensing system. And we are really fortunate to have with us a panel from the Georgia Department of Early Care and Learning, as well as reflections. Toward the end, goodness sakes, okay, we froze again. So I see your messages. I appreciate y'all letting me know. Hopefully audio is coming back and y'all can hear me now. Tatiana, can you let me know?
Amy, I can hear you now.
Okay. We will talk towards the end of the session about upcoming opportunities and also have an opportunity for you all to provide us with some feedback. So Tatiana, we can go ahead and move to the next slide, please. I want to take a moment just to introduce you to the panel that we have with us today. You'll be hearing from Dr. Bentley Ponder, who's with the Georgia Department of Early Care and Learning, also known as Right from the Start. He's the Deputy Commissioner for Quality Innovations and Partnerships. Pam Stevens is also with DECAL, and she's the Deputy Commissioner for Child Care Services, which is DECAL's licensing agency. And then Jennifer Bridgman also works with Pam in Child Care Services and is the Director of Process and Policy Initiatives. And we'll also be hearing from Randy Hudgens, who is the Director of Research and Policy Analysis at DECAL, and Shayna Funk, who works in the research division with Randy and is the lead policy and business operations analyst. And then Dr. Diane Early is with Child Trends, and she's going to be sharing with us some information about external evaluators. So we're glad to have all of them along for this session today. Before we get started with their presentation, we want to take just a moment, and I want us to think about and kind of lay some context for the session and in thinking about consistency and how it relates in licensing. Our center does a lot of work with family child care panels and different groups of providers across the country, and oftentimes
Amy, we're unable to hear you for the moment, so we'll give you a couple of seconds to see.
Okay.
There we go. You are back.
Okay, great. What we're hearing from a lot of the providers in the field is just the importance and the desire for licensing agencies to be able to have consistency among their licensing staff and with interpretation of rules. And so what we often hear, the couple of quotes that you see here just speak to that. They talk a little bit about how sometimes inspectors see the regulations really differently and the importance of having continuity and consistency. I am going to also, since we are having some difficulties, please pardon me, but I'm going to turn off my camera in order to hopefully help with the audio. So I hope that you can hear me from here on out. Tatiana, we can go ahead and go to the next slide. In thinking about that consistency, one thing that we often know is that is very, very hard to maintain as licensing agencies. We know that, licensing agencies and providers oftentimes are, hopeful to be consistent with regulations as well as the providers, and it does not come easy. The fact of the matter is all licensing staff are not the same and not all situations are identical. So if you take a look, like with many things, perspective is going to play a very key role. And so if you take a look at this first bullet and this regulation that says providers must report all serious injuries to the department immediately. The two terms that are underlined, serious and immediately, are all of us are going to have our own definition, our own interpretation of what that means. It just goes to show how important it is to have terms defined or to have policy clarifications in place, because it will vary widely, and we all come to our roles, especially in licensing, with different life and professional experiences, we're going to view things differently. It may be that a frontline licensing staff is out on a monitoring visit and they're focusing on one area when something occurs somewhere else. You don't have, you can't be in all the places at all the time. Your background, I know as a licensor, when I was in the field, I probably honed in on things on the playground more so than maybe some of my colleagues did, because that was just my area that I kind of focused on a lot. And so what we want to think about today is, as licensors, what can we help do to improve that consistency? And so if we take a look at the next slide, it just talks about what quality assurance is for licensing. In order to meet the principles of due process and fundamental justice to child care licensees, the licensing agency has an obligation to apply licensing rules in a consistent manner throughout the state, territory, or tribe, and from one inspector to another. That's actually an excerpt from some NARA curriculum, the National Association for Regulatory Administration. That said, we can define quality assurance the way it's listed here on your screen as a means for evaluation of a licensing program's effectiveness in the fair and equitable implementation and enforcement of the licensing statute and applicable regulations. And so Shannon is going to be dropping a link in the chat for you to this brief that is, it's a brief that our center developed several years ago, but still has very relevant information related to quality assurance. And when we think about that definition of quality assurance, what we want to think about also is the why. Why should we invest in quality assurance strategies? And it does take a lot of time and energy and extra staffing to be able to implement effective quality assurance measures, but it's valuable to do so because they help ensure that the child care licensing rules are applied consistently and fairly across your jurisdiction. It also helps child care licensing staff follow the policies and procedures established by the licensing agency. It also gives the agency a chance to offer providers the information and support they need to become, and probably even more importantly than becoming licensed, to remain licensed and comply with the regulations. Lastly, it also can help families gather the information and support needed to select and evaluate child care programs for their children. So I just wanted to let you all, think about that context and think about consistency as we get ready to talk about a variety of different quality assurance strategies. And with that context set, I am thrilled now to turn it over to Dr. Bentley Ponder. Bentley?
Sure. Thank you, Amy. And just want to make sure that you can both see and hear me before I get started.
We can. Thank you.
Okay. All right. Thank you. And good afternoon to everybody. It's really nice to be here. And I'm always happy to talk about some of the strategies that we've used in Georgia. And I'm also really happy to be able to present with a lot of my colleagues. So I feel very fortunate to be here at DeKalb, and one of the things that keeps me here are the great people that I work with. So glad that we're all able to join. So next slide, please. So just to kind of kick us off and kind of do a little bit more about, following from Amy's lead, I think when you're thinking of quality assurance strategies, you have to think big and you have to think across different methods. And so what I have here on this slide, I guess you could term a little bit of a spoiler alert, but it themes out or buckets out some of the things that you'll hear about over the next couple of slides and through the next couple of speakers. Because I think what this shows is it's our approach to quality assurance, but it's big and it also involves multiple strategies. So, you have onboarding. So when we have licensing consultants, as you'll hear from Jennifer Bridgman in just a second, we have a very detailed process in onboarding new staff, but it doesn't end there. And so it also goes to professional development that is ongoing for our licensing staff. I think a big part of our quality assurance strategies is transparency. And when I say transparency, the way that we interpret the rules, the way that we expect our licensing staff to evaluate the rules, we also share that with providers. So I think you're going to see a really interesting tool that we use here. One of the things, and for those of you that know me, that I'm very passionate about is our research and data support that we have here at the department. And so we're going to show you some of our internal analyses that we do along the lines with data. And then I'll talk about some, bigger projects. Following that, Diane Early is going to talk about an external evaluation approach to quality assurance. One of the things that I would just say here too is that when we talk about research and data analyses, it's not just enough to do those analyses. You also have to have ways in there for feedback loops and discussion, because I think that's really where you see the importance of those come in. We'll also talk about how we, by supporting programs and giving them the supports they need in terms of meeting standards, that actually becomes a part of quality assurance. And then just to say, we are a pretty big agency, but I would say that quality assurance is part of our overall framework at DECAL. And so having that across multiple programs then strengthens those individual programs too. So with that, I'm going to turn it over to my colleague, Jennifer Bridgman. And I know Amy had her title up just a second ago, Director of Process and Policy Initiatives. I would just want to say that's a new title for Jennifer, and congratulations on that.
Thank you, Bentley. I appreciate it. I want to check and make sure visual and audio are working on my end too. So.
Looks great, Jennifer.
Okay,
Well,
great.
thanks.
Thank you, Amy. All right, good afternoon, everybody. Like Bentley said, my name is Jennifer Bridgman. I'm the Process and Policy Initiatives Director here at DECAL in the Child Care Services Licensing Division. And we wanted to just kind of briefly give you an overview of what that licensing division looks like for us. So Child Care Services is responsible for the regulation, the complaints, opening enforcement, quality improvements, basically everything related to license and exempt programs throughout the state. Our team is about 160 members split up over 16 different teams. You can see on your screen there the way we are broken up, but we are broken up into 6 regional teams that handle the licensing and compliance and kind of that day-to-day regulation and monitoring of programs. And then we have specialty units that are responsible for specialized skills or certain areas within the licensing component. So for example, our complaint unit handles our most egregious category 1 and 2 complaints. Our exemption unit handles our exemption programs, things like that. I wanted to just let you know that in our process and quality improvement unit, that is how it actually houses our training and communications, as well as our quality assurance and mentor consultant teams. So the combination of all of those kind of make up what is Child Care Services for DECAL. Just to give you a little bit of background for the work that we've done in FY19, which I use this term loosely, but for us was the last quote unquote normal year, right? Our CCS licensing staff conducted 63,820 visits. We regulate programs by doing visits twice a year. Each program gets a licensing study and monitoring visit from our Child Care Services staff yearly. In 2020, with the emergence of the pandemic and all the shutdowns, we moved to and adopted a virtual licensing process for regulation. And since 2022, we've moved to sort of a hybrid process for the time being, with still some virtual visits and some in-person visits back in the programs. But also we have maintained and kept an electronic records review process for files, documentation, records, things like that. So that's kind of an overview of what we're doing and how we're doing it and how we're kind of set up. Next slide, please. All right, so I'm going to talk to you for just a few minutes about our licensing efforts, and I'm not going to read through these, but you can see on the screen, we're going to touch on each of these initiatives, and I'm going to give you a little bit more information about what that looks like for us and how we're implementing and using some of these tools and resources and things like that. All right, so the first thing we're going to talk about is peer and supervisor observations. So our Child Care Services division uses a variety of these tools and opportunities to kind of assess staff competencies, assess their skills, kind of give feedback. Our onboarding skills checklist that we use is a summary of our skills that are either observed, practiced, discussed during the onboarding process, things that they are learning and the opportunities that they're being provided and how many of those are being provided, the quality, the depth of the instruction that they're being provided, that kind of thing. Our virtual and in-person skills checklist, these are conducted during our onboarding process. And these are checklists of skill competencies that consultants are demonstrating in programs or in training. And what we do is kind of base those on a leveling of, do they need additional support in that area? Is that a skill or proficient or competence that they've mastered? Is it something that they're just proficient in, but they might need a little bit support? All of those kind of things. So all of these are job specific functions that we've deemed kind of important or necessary for the consultant role. The last one is our manager skills review checklist. And these are used by our managers and conducted annually on staff to assess their skill competence, things like rule evaluation, policy interpretation, things like that. And they're used for feedback in job performance. And then they're also part of the required annual performance review done annually at the end of every year. Okay. All right, so Bentley mentioned to you guys at the beginning about our onboarding process. And our onboarding process for licensing staff is both a combination of classroom training and practical skill application in programs. It's currently broken into 2 phases, with each phase having kind of skill specific things and dedicated to certain training and functionality and things like that. But phase 1 is for foundational skills and knowledge needed for the job. And then phase 2 is for what we deem more like the quote unquote specialty skills that you would build on top of skills taught in phase 1. So you can see on the slide there that phase 1 typically lasts for us about 10 weeks, and then phase 2, 6 weeks. The in between of those phases is a time period that allows the new staff to have, an opportunity to practice those skills, to become comfortable with what has been taught to them. So they'll take a couple of weeks, and once they complete phase 1, they'll have this interim to be able to do the job function, to do those basic visits and things. Then they'll come back for phase 2 to build upon those specialty skills and get more in-depth practice with things like complaints, amendments, required reports, things like that, you don't have to have, you need to have the foundational knowledge, but you don't have to have those quite as early in your onboarding to be able to do your job in just the basic rule interpretations and visits and things like that. So during the practical skill application visits of our onboarding process, new staff are paired with mentor consultants or selected coaching consultants who've been instructed on how to train staff in a uniform and consistent manner, following the principles of, I'm going to do it and you're going to watch me. We're going to do it together, and you're going to ask questions, and we're going to have feedback, and we're going to have conversation. And then ultimately you're going to do it, because I'm going to turn it over to you and allow you to use the skills that you've developed. And I'm going to observe you from that point. We also have embedded what we call mentor meetups that are conducted after every practical skill application piece or their visits. And this is to discuss with them, what they've observed, questions that they may have, the methods in which they were taught. This allows for us consistency in not only training delivery, but also our quality assurance checkpoint on how are the mentor consultants doing it? How are the selected coaching consultants doing it? How is the training consultants teaching it? So that we can make sure that across the board that's streamlined, and that we're instructing staff and demonstrating skills that are consistent across the board. Okay. So after they've onboarded, and for all of our veteran consultants and all of our staff within CCS, Child Care Services we've implemented in FY 2019 that all licensing staff are required to obtain 24 hours of professional development training. And this is annually every year. Surveys are conducted with CCS staff annually to evaluate trainings that are offered the previous year, areas of interest, that staff may have opportunities that they would like to see made available to them. And our process and quality improvement unit and training staff are responsible for putting together these trainings, for providing monthly training calendars, sending out newsletters and information to allow them to see, what training opportunities are available. Included in those options offered monthly, there's opportunities for skill-specific things, so things that are like directly related to rule interpretation, policies and procedures, interviewing, things like that. We also have opportunities for job-specific training, so things around child development, best practice, licensing practice, safety, et cetera. And then opportunities for special interests, so things like technology, book clubs, leadership training. We've done just a variety of different things. Most of our trainings are developed in-house, but we do bring in outside sources, so other state agencies, collaborating partners like our Children's Healthcare of Atlanta training partners. Then we also link to just outside training sources, that we have found that have been valuable and things like that. We try to offer trainings. Right now, they're all in a virtual format, but we are looking to get back into in-person formats. And then we do them live. We record them and offer them that way. We also have many that are self-paced, that are housed in our professional development library or in our Georgia Professional Development Registry. So they have access to them year-round to be able to obtain those. And we're constantly updating and adding to those as we're coming across them as well. Next slide. Okay. So now we're going to talk about some interpretive guidelines that we use for our provider community. For both child care learning centers and family child care learning homes, we have combined all of our licensing rules and regulations with what we call an indicator manual to be used not only by our licensing staff, but also our provider community. So these are given to our licensing staff to use in the programs, but these are also made available on our website for the provider community to access as well. Same information, same books, everything. These guides are available and they're updated quarterly as new clarification is needed, or things are coming up from the field that we're needing to provide clarification on, scenarios that might be encountered that we haven't thought of or addressed, and we're constantly updating these. These tools are used to provide that transparency in the way Child Care Services interprets rules and regulations, and then also how we evaluate those in these programs. So for the provider community, these have been well received because for them, this is like a one-stop shop really for what are the rules and regs that I have to follow? What are the interpretive guidelines? How are you going to evaluate this in my program? And then it also provides a place for like best practice and resources and a clear understanding of how things are evaluated for compliance. Next slide. Okay. So just to kind of give you an example of what these look like inside, this is an example of a page from our child care licensing indicator manual for the rural diapering areas and practices. You can see at the very top there that the information where the number 2 is, 0.102, is the actual rule for the licensing. It's going to indicate whether it's a core rule or a non-core rule. Our core rules are rules that we have deemed the most impactful on the health and safety of children in care. And these are rules that are evaluated at every visit. So at every monitoring visit and every license study that we do in the program. The non-core rules are evaluated only during licensing studies, and those are only, and then also if there's like a follow-up needed because there was a non-compliance issue in that area from a previous visit. In addition, you can see, go just back up, there you go. There's also a section for clarification, and the purpose of this is to tell you, what is the purpose of the rule? Why is it that it's important? And then indicators, as you can see below, and these indicators are exactly how our licensing consultants are going to be evaluating that rule in your program. So you know that we're going to observe this area or check these things or ask these questions of the staff or of the director or whatever. We're going to look at this paperwork. So it gives the program staff and our licensing consultants indicators for how to evaluate that rule. Okay. And the next part is also we embed our core rule severity level. So if it is a core rule, this severity level is going to be included in that manual, and it's going to indicate where potential rule violations would fall in terms of our compliance determination chart. So if it's, if these were what would be observed, this would be what would have to happen for it to qualify for a TA, for us to provide technical assistance. If it was this scenario, then this would be a low risk violation. These would be medium risk violations. You can see how some will have high risk and extreme, some will not. So like for diapering, unless it was something where like was a child left unattended on the diapering table and the child could roll off, that would be seen as more of a high risk type situation. And then for the things for childcare programs to consider, these are like best practices, tips for providers for maintaining and ensuring compliance. And we also put in here kind of links to resources, documents, websites, anything that we know that's available to them, whether that's our website information or somebody else's that can help them access information about this particular rule. Okay. One of the other things that we do in childcare services is we do provider surveys, and these are included on every visit report that a childcare consultant does in a program. So after they complete their visit and write up their report and get it to the program provider, at the bottom of that licensing report is information that includes access to a survey that allows them to go on and evaluate the visit, the licensing consultant, how things were done. The questions on your right-hand side are the questions that are asked specifically in the survey. So you can see, it asks, was the child care consultant XYZ? Were they able to answer questions? Were they those kind of things? I'm not going to read those to you, but those are there for your reference in case you're interested in that. But these surveys are to kind of encourage providers to give us feedback, not only on, how the staff were in the program. Were they respectful? Were they helpful? Did they know the answers to your questions? But also, how are they evaluating the rules? Did it seem like they were fair in their assessment of your rules? Did they include you in the conversation for the plan of improvement? Did they evaluate things the way that you feel like they should? Was it done, the way the indicator manual indicates that it should be? All of these surveys are done electronically, and then the feedback comes back in kind of in a rating scale and free-form comment. And it also allows providers to say, there was something that didn't sit well with me, or I really want to have a conversation with somebody about. So it allows you to request a follow-up from a management team member to then follow up either to that visit or regarding that consultant to be able to kind of figure out what those concerns are. This has proven to be mutually beneficial in our provider consultant relationship because it provides that space for, the provider community to give us an honest interpretation of this visit, but also it allows consultants to kind of in retrospect look back and identify any areas where there might have been improvement or changes that they needed to make in the way they were doing things or the way they interacted, et cetera. Okay. Our quality assurance initiative. So the CCS quality assurance initiative is driven by the work of our mentor consultants in the process and quality improvement unit. And their purpose and the purpose of this initiative is to take a really intentional look at the way rules are evaluated in programs and the way policies are being followed by staff across the division. So some of the things that we're doing, shadow visits are being conducted to identify where there's variations in practices, and then conversations are held in a variety of formats with managers and a consultant work group to identify best practice and plans for professional development to communicate those. So if there's something identified, what does that mean? What would be best practice? And then how do we get everybody onto the same page, right? In addition, an analysis of our internal data is reviewed as we're partnering with our research team. And that's to help us identify areas, where we need to focus. So it might be things like, what are our most cited rules? What are our least cited rules? Where are most of the staff giving technical assistance versus citing? So that kind of data is how they kind of help us, guide our focus and kind of areas where we might need to kind of hone in on. We're then taking all of that information, creating professional development around that to support clarification of learning, and then policies, if they need to be revised, are being revised to reflect best practice. These changes are updated and then communicated across the board and followed up in subsequent rounds for consistency purposes. Our onboarding, as I mentioned earlier, through the use of these selected coaching consultants and these mentors, also follows the same methodology, because it's it's structuring the interpretation, and it's also scaffolding learning so that you're getting consistency across the board. This work is important because it not only allows us to identify areas, where we're seeing inconsistency in practices, whether that's due to training, whether that's due to personal preference. Like Amy mentioned, she might have been more honed to focus in on playground things. There might be some consultants who sleep safety is what they're passionate about. So those, just by nature, if you have something you're passionate about, that's what you're going to kind of focus in on. And what we also know is that there's kind of generational practices or generational importance. So at one point, the department may have been focused on transportation. At one point, the department may have been focused on staff-child interaction. So we know that we kind of ebb and flow through what's important as things are happening in the environment, as things are happening in the states, and that kind of thing. So what is it that has made this drift in interpretation? So streamlining all of these policies and practices, identifying most importantly where these are, helps make this work of the consultants easier, because then it can provide that kind of clarification and transparency across the board. And then the last thing I was going to talk to you about is our Bridge to Quality initiative. In some of our research studied by CCS, what we found was that over a 10-month time span, 14% of the total programs served by the Child Care Services Technical Assistance Unit were newly licensed and had fallen out of compliance with rules and regulations within 1 year of beginning operations. So what we decided to do was do a pilot project that was done between October of 2019 and February of 2020, during which we had 11 newly licensed programs identified for participation. And the purpose for them participating in this was to provide a positive and proactive support for these programs to help them create systems to maintain compliance with their rules. So once they were in this initiative, they received regular intensive support from our TA staff. They conducted an initial needs assessment with the program, and then they also provided the program with targeted coaching and intensive training around rules and regulations, and then also through a management series training provided by the McCormick Center that was for business practices and kind of some of that basic foundational knowledge for business operations. And what we found was the benefits of this initiative with this personalized support. They not only got a better understanding of decal systems and programs, they also had access to this professional development. They had these resources and links to outside support. And of those 11 programs involved in the pilot, 10 of those 11 are still in good standing and are quality rated at either a 1 or 2 star. The 11th program has actually closed. So for all intents and purposes, very successful in terms of the data that came out of that. This project is actually still ongoing, and there's currently 18 programs involved in this Bridge to Quality initiative. All right, I'm going to turn it back over to Bentley.
Sure. Thanks, Jennifer. And I can't help but think, just, listening to that, just how helpful those interpretive guidelines are. Every time I see them, I think, wow, what a great tool to get both consultants and our providers on the same page. So we're going to shift gears a little bit and talk about our research and policy support of quality assurance and licensing. As Shana Funk will talk about in just a second, we have an internal research team, and that team is here to support all of our different departments. So she's going to talk about that team and a little bit of their analysis, and then I'm going to talk about some other projects. So Shana, I'll turn it over to you.
All right, thank you, Bentley. And thank you, Jennifer, for that great overview of some of CCS's quality assurance strategies. and good afternoon, everyone. Thanks for joining us. As Bentley said, I'm Shayna Funk, and I'm part of DCAL's research and policy analysis team that I'm going to talk a little bit about here. So DCAL has our internal research team that supports our department. We're currently a team of 7, and we do things like conducting administrative data analyses, designing and implementing internal research projects, and also just managing some larger external evaluations with other partners. So we really just support the whole agency with any data and research needs that we have. And there are also a couple ways that our team specifically supports quality assurance with our Child Care Services division. So in the past, the research team has created and implemented a formal Interrater Reliability process with our licensing division, which we'll talk a little bit more about later. And we also manage some research studies on specific topics of interest. For example, we did an exploratory study on the quality of school-age classrooms in child care centers that just helped to inform how our licensing consultants can better support school age. And we also conduct ongoing administrative data analyses that provide CCS leadership with the needed data to make decisions. And I just want to pause here and talk a little bit about the infrastructure that allows us to do that. So DCAL is a little unique in that we house so many ECE services under one department. And we have a really robust IT team as well that has created some internal data systems for our different programs that we can access as needed. So like our Georgia's pre-K program, and of course, like our licensing division, we're able to access that data through them. So when we want to analyze licensing data, like citations, capacity, and any other information that's collected during those visits, we're able to just go to our IT team and ask for the data that we need. So our research team will work with CCS on what they might want to look at. And then in turn, we can work with IT to pull that data from our internal systems, which for licensing is our Koala database. So now I just want to show you some examples of what we can look at with these administrative data analyses. So when we're analyzing data for our licensing division, particularly with a quality assurance lens, one of the things we do each quarter and at the end of the fiscal year is just take a high-level look at the rule determinations recorded in that period. And this just helps to facilitate a conversation between CCS and the research team about just kind of the landscape of rule determinations at that time and what's happening during regulatory visits. So we can ask, does everything look as expected? Can we explain any differences in the data, and what might we need to take a closer look at? So for example, here we're looking at which rule chapters we saw the most citations in for fiscal year 2021. So that's July 2020 through June 2021. And the blue bars here are representing citations for our child care learning centers, and yellow is for our family child care learning homes. So I chose to talk about fiscal year 2021 data in particular because, of course, this is in the midst of the pandemic. The consultant visits at this time are virtual. So we know that the types and rates of rules being cited are just going to look different. So we want to pay attention to what's happening all the time, but of course, especially then. So here you can see the top cited rule chapter for both centers and family child care at that time was the staff records chapter. So we would look at this with CCS and ask, did we expect this? Can we explain this? We know that during virtual visits, consultants may be able to spend more time reviewing the paperwork side of things, so maybe they're catching more administrative type rule violations. But we can also drill down more as needed. So specifically here, the top rules cited within this chapter were for annual staff training hours and health and safety training. So, was accessing training an obstacle at the time for providers? We can also compare to previous years. So for example, fiscal year 2019, which is our closest pre-pandemic reference, the top cited chapter for centers at that time was the facility chapter, with the top rule being for playgrounds. But we know that during virtual visits, the consultants weren't able to see those things as much or as well. So that makes sense that that one dropped down a bit. So overall, I hope you can just see that this one look at the data really helps to spark that discussion between the licensing and the research team, and just make sure we're thinking through the implications of what's happening in programs. And we can go to the next slide. So we also like to look at just the total number of citations and technical assistance determinations. So when there is a rule violation, a consultant has a few different enforcement actions they can take depending on the severity and circumstances of the violation. One of those, of course, being a citation, and another being technical assistance, where they can help the provider understand how to correct the violation. So here we're looking at the total number of citations and technical assistance determinations by quarter for the fiscal year 2021. And again, here blue is for our centers and yellow is for our family child care learning homes. And the top 4 bars here are representing the number of rules determined as not met or citations for each quarter. And the bottom 4 bars represent the number of technical assistance determinations. And so when we look at this, what we might focus in on here is that we see in quarter 3, technical assistance went way up for both centers and family child care. So that's where we'd start the conversation with our licensing division. Can they explain why TA was so high in quarter 3? And that's also where we might want to drill down and see which rules specifically are driving this as well. So for example, we know that there was a rule change in nutrition and food service around this time, and that's actually one of the top rules that are driving up the TA here. So that makes sense that with a new rule change, consultants might be opting to provide more technical assistance until providers are familiar with the new regulations. So this chart and the previous one are just 2 simple examples of ways we can look at the rule determinations data. And there's a lot more we can do. We can drill down by rule or provider type. We like to look at trends over time across years. We can look at the other kinds of rule determinations. So these visualizations of the data really just help to facilitate that conversation between licensing and the research team about just the current or past landscape of rule determinations and what's happening during those visits. I think a big part of quality assurance is just knowing what this data looks like and being able to have those check-ins and times to ask, does this look right? Can we explain this? Do we need to be doing anything differently? And not only do we share this data with the leadership in our child care services division, but we've also shared it with consultants who, of course, being the ones going into these programs, are going to be able to give a lot of really helpful context to what we're seeing. So that's been really helpful just to have that discussion at every level. So overall, I think just taking the time to look at this data with our licensing team and spark those discussions is one simple ongoing way we can make sure we're applying a quality assurance lens to licensing consistently. And now I'm going to turn it back over to Bentley to talk about some of the more formal Interrater reliability we've done.
Sure. Thank you, Shana. And, again, I think I've talked about it and I know that you've talked about it too, but really that a key part of what you just shared was that those discussions and those feedback loops that I think help make sense of the data and then provide opportunities for additional professional development or additional clarification. So I think you saw that the interpretive guidelines that Jennifer mentioned, I mean, those were recently updated. So knowing that data and having that data can help identify where those guidelines need to be updated. So I'm going to close this part out with discussion of 2 different research projects we did, all under the umbrella of Interrater Reliability. And when we talk about Interrater Reliability, what we're really saying is if you have 2 assessors, 2 consultants that go out and see the same thing, would they score that the same way? This is something that's really big in terms of pre-K or, with us with quality rated and using the environment rating scales. And so as you'll see in just a second, we took some of that knowledge that we learned from those programs and using more formal research instruments, and we applied that to our licensing. The first part of that, though, was really, again, going back and understanding the data. And so we did an administrative data analysis. So what I'm going to show you is something we've done in the past. It helped kick off a lot of the quality assurance supports that Jennifer and Shana have talked about. We have not done this analysis in the past in the past few years, but I think as we're getting back out and doing live observations again, this will be something that our research team and child care services will still look at. I also want to point out that our director of research, Randy Hutchins, is also on the call, and Randy and I work very closely on these projects here, and I know he'll be able to answer some questions and also be able to provide more context to some of what Shana just shared. So on this administrative data analysis, what this did was it showed us where there were differences in scoring meaning if we have, as you'll see in just a second, consultants scoring differently, that probably couldn't be explained by actual differences. So when we say differences in regions, meaning that where you wouldn't expect one region to score differently than the other. And the purpose of this was really to identify where we have supports and professional development opportunities. So next slide. So this is a former chart, and what you can see here are just some data. So where you see 1151, 1101, and so on, those were actually numbers used to identify consultants. We never wanted anybody identified by name, so those were the numerical IDs assigned to consultants. And then that first part just shows the number of visits for each consultant. So when we say CCLC, that's Child Care Learning Center, Family Daycare, that's our former name for family daycare homes. Then we also at that point in time had group daycare homes. Those have now been absorbed into our centers. And so that first part just talks about the number of visits. But it's really that other side of the chart that's interesting. So those show you the percent of visits where there were findings. In other words, what percentage of visits do consultants have at least one finding, one or more findings? And so you can see that consultant 1151 actually had a much lower percentage than the others. And then you can see that consultant 1101 actually had a much higher percent of visits with findings. And so those vast differences tell us that there may be more going on than just differences from what they would see in those sites. I think it's also helpful to always to be able to look at averages. So there you can see, generally about 2/3 of visits at this time had one citation or more. And so, then you can look at each consultant's average and compare to the general average. You will see there's a little bit of a high standard deviation there, which means there is a fair amount of variation just across all visits. And so, that kind of helps explain some of the differences you see and also helps you in interpreting the data. But what we would do with this is we would look and see where we would really have our outliers and say those might be the consultants that are identified for just needing more professional development and support. This is just one piece of the puzzle. You, of course, want to look at a whole host of other things before making any personnel decisions, but it gives you a good way to look at your data. And also, we used this when we were building our IT system, so our data systems could generate these reports on a somewhat regular basis. Next slide, please. And so this just kind of tells you the same thing. It's just looking at it a little bit differently. So whereas the previous slide looked at the percent of findings per visit, this looks at the average number of findings. So again, you have the same number of consultants. You can see that consultant 1151 had less than one of an average finding per visit, whereas consultant 1101 had 5 average findings. And again, these are averages. I always caution to be careful with averages. Many times the median is a much better measure, especially if you have a lot of outliers. But if the average is 3 and you see that you have consultants that are really below or above that average, then again, that can give you some idea of where those which consultants might need more support, or maybe what other tools you need to create to help support consultants in general. Because what you can do with these is then you can start looking at, okay, what are the rules that are most often cited? And maybe that helps explain some of the discrepancy in consultants, because those can then be, you can look more in depth with those and say, oh, maybe we need to provide more interpretation for these. So again, this is an older study that we did. It's from several years ago. I mean, we are able to generate this data, still. I would imagine that we'll do that after we have a fair amount of visits under our belt, since we just started our formal live observations in January. But it does give you a really good sense of the data. But again, you've got to be able to have the context of where you can have those discussions and interpretations with that. All right, next slide. So I'm going to talk a little bit about something that I would say was less successful in our Interrater reliability. I think it's always important to look at both your successes and your projects where you had some challenges. I would say that administrative data piece we were really successful with that. That gave us good data. But then we tried a project where we were more formalized. So I mentioned, in Georgia's pre-K, where our consultants use the class instrument, the classroom assessment scoring system, and then quality rated, where our assessors use the environment rating scales. Those of you who are familiar with those know that there is a formal Interrater, process. With our quality rated, we have anchor assessors, and they are the ones that then train all of our other assessors. And then after so many visits, go out and do co-visits, and we have a certain percentage that they have to be reliable with. So what we did with licensing is we tried to do a similar project, and in many ways it was successful. I think it's for more, it's not the data that I think made this more challenging. I think it was really kind of the way that it was communicated. But what we did is we had a group of consultants that we identified as lead anchors, and we had them all become reliable with each other. And so what that means is they would go out, they would do a visit together. You'll see, we did have a very, strict protocol that they were trained on. And then so they would establish reliability with each other. Again, very similar to what we would do with class or our ERS. And then they would go on joint visits with consultants. And then what they would do is they would go do visits together. As soon as they were done, they would scan their sheets, then send them back to us, and our research team would then analyze that data. Where we saw consultants not able to attain reliability, we provided additional supports. This project in and of itself right here was not part of a performance plan or anything like that. It was really just to see where we had gaps, what are the rules where we needed to have more support on, and where, should we have more professional development and training for our consultants. Don't get bogged down with that last bullet. I kind of laugh about that. We actually did a lot of research when we started this, and there are different ways that you can analyze the data, percent agreement. So, how many of the rules that they examined did they agree on? Generally, with quality rated, we like, 90%. Then there's also some statistical measures called the weighted kappa and the ICC, or interclass correlation. Back in the day, I could have probably explained those better. It's been a long time since I looked at them, but I just wanted to keep them on the slide because to let you know, there are different ways of looking at, reliability, different measures. And if you go to the manuals for the ERS, you can actually see some discussion of these measures in those manuals. All right, next slide. So I mentioned, the protocol that we had. So we would have the lead, we would have the anchor take the lead, and if there are questions that need to be asked, they would ask those majority of the questions. They would go together in tandem, visit each classroom, get the head counts for ratios, follow up on previous citations, and then look at all core rules. So, we focus this on our core rules, not the full rule book. It's very important in doing this that the team stays closely together so they see and hear the same things. We did have our teams not discuss the scores with each other until after score sheets are completed. And then after the conclusion of doing that, the lead anchor would actually, type that up. Those would be the scores that would go into our data system, and then they would fill out the score sheet. All right, next slide. And then, so just in terms of the, of the lessons learned, first of all, the data piece and the other things we've mentioned, we have the infrastructure here to manage that. The Interrater process, actually, we didn't have the infrastructure. We didn't have that. That is a very time heavy, very project-y management system to do. So even though we have a research team, it was smaller then, and even though we had the IT system, that was still really difficult to manage. So I think that's, that's why I would caution on doing any sort of formal Interrater process until you're sure you have that infrastructure. And then I would say in some ways too, because we wanted to make sure that it was formal, that it mirrored some of those other things that we have with our ERS instruments or with our class instruments, it formalized it in a way that created some tension with our consultants. And I think it was too overstressful. I mean, I think it created too much stress, which in many ways is a stressful job. So, it wasn't meant to be part of a performance plan, but I think it was so formalized that many consultants saw it that way. So, honestly, if we had to do it again, I think I would dial it down a bit. I would really focus on the way that we communicated it, and just look at ways that it could be less stressful. But I will say, it did give us a lot of good data. We had a lot of great analyses from doing these, and so you factor this on top of the other administrative data that we analyzed, and then all the pieces that we have in place now, it gives you some really good examples of how you can use a research and evaluation team as part of that. And I think that is a great segue to my friend and colleague that I have enjoyed seeing as we've been preparing for this, who can talk about, some of the tools that you may have at your, available to you with some external researchers and evaluators. So kick it off to you, Diane.
All right, thank you so much, Bentley. Hi, everybody. I'm Diane Early, and I'm a senior research scholar at Child Trends. And I thank you so much for coming here today and trying to think about quality assurance within the licensing system. Just briefly, Child Trends is an independent, nonpartisan, nonprofit research firm, and we're one of the many types of external partners that are available if you're interested in partnering with external researchers or evaluators. And I'm just going to spend a few minutes today talking about what that process is like, why one might partner with an external researcher, and also just go over a few of the studies that have happened in Georgia's licensing program to give you kind of some ideas about the types of work that's possible. I work for Child Trends. I do not work for DECAL, but I have worked closely with DECAL and pretty much everybody on this panel for the last 10 or more years. So I have a lot of experience in Georgia and also in some other states. Next slide. So who are external researchers and evaluators? I would say they mostly fall into two big groups, and that's departments and institutes within universities. Probably many of you have research partners in your state. You have an early childhood department or a policy department in a local university that is available to partner and do research projects with you. And then there's independent research firms, and that's like what I work for, Child Trends. And in both cases, you can have specialized knowledge in early childhood. People may have specialized knowledge in policy. And then there's research methods that we often have knowledge of that maybe aren't things that everybody within a state department might know. Next slide. Just quickly, how would one go about connecting with an external researcher? There's kind of two extremes. There's probably some middle ground, but one would be a formal RFP process. That's request for proposal. So that's when a state or a department puts out a formal request. Lots of different types of organizations might bid, and then you choose amongst them. But on the other end it's perfectly acceptable to simply reach out to evaluators that you've either worked with in the past or that you've seen work from that you liked, and ask them if they're interested. Now, your state may or may not allow that. That's an internal question, but in terms of the research side of that, that's a normal thing that happens all the time, that people reach out to us and ask for our assistance. Next slide. Why do it? What's the upside for you? Well, external researchers and evaluators often have specialized training in data collection and data analysis. We often have access to statistical software and analytics skills. We're trained in these kinds of things in a technical way that may not be present in your department. Past work with other states sometimes can give perspective, meaning if you've heard of something interesting going on in Georgia, finding a person who understands what's going on in Georgia might also help you, even if you're in a different state. Many of us have done a lot of work with the federal government, so we often understand the federal rules and guidelines that are governing your work. And I would say that last one, time, is one of the biggest ones. You are all busy doing 3,000 other things, and research partners generally do one thing, which is research. So if you have some research questions that you wish you could get answered, but you just literally don't have the time, it might be a good time to think about partnering. Next slide. Few things though I want to remind you when you're thinking about this. You are the expert. If you are going to reach out to a partner, you should not be intimidated. You should not let that partner tell you what's interesting or important. You are the ones who are going into this with a question or an issue that you're hoping to get resolved, and there's no need for intimidation because you're the ones who know what's going on in your state and how to interpret things. You should always have a role in defining the questions, the methods, and especially interpreting the results. I know Shana was talking about meeting with the licensing people to make sure that they understood what they were seeing on those graphs. And you would expect the same from any kind of external partner. And the last one is just, I know sometimes it's scary to do research because you might get an answer that you didn't want or that doesn't put you in the same positive light that you'd hope for. But we hope that the research is always helpful in making decisions, in making improvements, and in kind of taking an honest look at what's happening in your state or in your system. I really want to emphasize that there's a lot of different types of projects that you might want to partner on, and they can range from big studies that are comprehensive, answer really big questions, all the way down to very, very narrow issues. And I'm going to talk about some pretty small ones today, just to kind of give you a flavor for the types of things that can be looked at through an external researcher. They can involve new data collection, meaning that a researcher might come in and collect some data within your state, or they can involve analysis of administrative data or sometimes analysis of other types of data that the state already has. And the results can go anywhere from a formal public report that you put on your website and there's a press release and everyone discusses it, or internal document that's just for your own use. Or sometimes you can use the information for some type of report that you're providing and you just need a few data points to add to something else that you're already working on. One more. This is almost a word of caution. You'll often need a data sharing agreement if you're going to be sharing data with an external partner. That's a formal written agreement that specifies exactly what the data, what's going to be shared and how it's going to be used. And that just protects both sides to make sure it's in writing. Nobody's confused about what the purpose is, and nobody goes off and uses the data in a way that's not appropriate. Whether or not data sharing agreements are needed really depends on your state rules, but also on the type of data you're sharing. Public data can often be shared without any kind of agreement. Next slide. So now I'm going to turn and I'm going to talk about some projects that DECAL, that Georgia's licensing division, have done with external evaluators. Some of these are child trends projects and some are not. I'm not really just doing this in order to give you a bunch of research results or evaluation results. The purpose here is to kind of spark your thinking about what kinds of questions could be answered using external research. And these are all licensing questions that have we've looked at. They're not necessarily all quality assurance per se, but I think understanding your licensing system and what's going on within licensing, it can always help you to improve quality and improve the consistency across how licensing is handled. So the first one I'm going to talk about, and these, like I said, I'm not going to give you a lot of details, but we're going to put links in the chat to the reports for each of these. So if any of them spark your interest, if you're wishing I would have said more about what was found or what was done, you can go to that link and download the report and get all the details that interest you. So this first one was called the Exemption Visit Project, and DECAL was interested in comparing the basic health and safety practices in license exempt programs to those of licensed programs. So the question was, what's happening in these license exempt programs, and are they as safe, and are their health standards as high as what we would see in licensed programs? And in this one, DECAL had some former licensing inspectors visit a sample of programs and complete a checklist of basic health and safety practices. So this was kind of a much more limited version of a licensing visit, but used the same rules for the basic health and safety. And they were former licensing inspectors, so they knew how to interpret those rules. And what we did at Child Trends was we compared the checklist to data from licensed programs. And this is a really interesting example because it's a case where DECAL collected the data themselves and then asked Child Trends to use those data to make some sense of them and do some analysis. Next slide. And the key findings from that were that licensed programs were significantly more likely to meet basic health and safety indicators for most of the rules. So the health and safety was just higher in the licensed programs. And what that said to DECAL was that license exempt programs may need some additional support in order to meet health and safety requirements. Next slide. This second project I'm going to talk about was one about differential monitoring, and I suspect many of your states have some level of differential monitoring going on, and so there's lots of questions about how well that's working and how do we decide what to monitor when. So in this one, this was not with Child Trends. DECAL worked with Dr. Richard Feeney, and I see that the link to this report is in the chat now if you're interested in hearing more. Worked with Dr. Richard Feeney. And DECAL wanted to know if the core rules that they were using to determine licensing compliance were valid. Were they giving you a good picture of what's going on in that center or home when they were just looking at these core rules? And Dr. Feeney combined a large number of data sources, including data from licensing and some previous quality work that had been done in DECAL, and put all those data sets together. And then going on to the next one, and he found that the key indicators, which was a separate set of standards that he had developed, that they were correlated both with the core rules and with the compliance determinations that were going on. So that gave some hint that some of the work that DECAL was doing around differential monitoring was valid. And also Dr. Feeney was able to provide suggestions for improving the compliance determination in Georgia. Next. This third study I'm going to talk about was the license exempt programs caseloads. And this is really a very different type of project we did, because we were trying to answer an extremely narrow question and really provide some information to the state that could be helpful. And again, there's a link in the chat if you're interested. So this was specific to the frontline staff that visit license exempt programs. And at the time, they were broken into geographic regions, but the staff themselves had felt that they were unfair. Those regions were unfair because they were taking different amounts of time and distance to drive to them. And you can imagine dense Atlanta is going to end up being a lot harder to drive across. It's going to take a lot more time than a more rural area. And so they were concerned that certain people were just spending too much time driving and other people that it just wasn't fair. So what Child Trends did was use the Google Maps application API to revise the regions. And they, analyst who works with us, did quite a lot of work looking at how long Google said different drives were taking in order to help them change the regions so that they were more fair. And can we go to the next one? And we found that there were 2 of the original regions that were requiring a lot more driving time than the other 2. And so Child Trends was able to revise those regions to provide more equal driving times for everybody. And what that did was reduce the total number of hours that the staff was spending in their car by several thousand hours per year. So it felt like a really useful use of data and a really useful time to bring in an outside consultant, outside researcher, to answer a very specific question about how we can improve the way that these caseloads were determined. And then this last one was done by Dr. John Carter at the Rawlings School of Public Health at Emory. And the question here was to look at fatalities in children who are in childcare with those in the general population. And of course, the goal is always to reduce the risk of serious injury and fatalities in childcare, and to find out how much risk is associated for children in being in childcare. And Dr. Carter used several sources of data, including vital records, DECAL's fatality incidence reports. And then next slide. And he found that Luckily, infant toddler death is extremely rare across the board. It's generally preventable. But interestingly, the risk of death is lower for children when they're in childcare than when they're in the general population. So although this is a very sad and hard topic to think about, I think people felt relieved to realize that childcare in Georgia is providing some benefit in terms of safety for young children, and that their odds of dying while they're very young, it goes down if they're in childcare. So that's the end, or that's all the research projects I'm going to talk about. Again, I'm hoping that they give you some notion of the types of questions that you might want to ask if you were thinking about working with an external evaluator, and the types of issues that external people might be able to take on that probably your own department just doesn't have the time or resources or technical skills to be able to address yourselves. The last part I wanted to do was just point you to a few more resources. If any of this conversation about external researchers has been of interest to you, there's some other resources that are available, and the links are going to be in the chat. Several of these were really written for CCDF administrators, but we know that there's a lot of overlap in the CCDF and the licensing world, and I think a lot of these resources would be of use to you, even though they maybe are written with that CCDF lens. So this first one is called Research and Evaluation Capacity Building. I think we're getting the link into the web. And this one, into the chat. And this is a resource guide that lists lots of valuable resources for you on many different aspects of research and evaluation. And there's a list here of the types of resources that are provided. Next slide. Then there's one called Procuring Research and Evaluation Services, a guide for CCDF lead agencies and researchers. And that goes into a lot more detail than I did today about how one would go about engaging an outside researcher, including defining a lot of the terms that maybe are unfamiliar to you if you haven't done that kind of outsourcing before. And then I think the last one is Research and Evaluation Capacity, Self-Assessment Tool and Discussion Guide for CCDF lead agencies. Again, the link is in the chat. And that guides the user, that would be the person reading it, through a process of reflecting on what is your own research capacity, what is it you're trying to engage an outside firm for, and what is it that you would, how would you go about getting that outside firm? So that's just some products for you. And that's where I'm going to stop. My email address is here on the web. If anybody is interested in reaching out to me, I'd be happy to hear from you and answer questions. And I think that the last few minutes, I'm turning this back to Amy. Is that right?
Thanks so much, Diane. Yes.
Thank you.
Yeah, thank you. Thanks to you and to Jennifer and Shana and Bentley and everybody that's participated. The panelists have done a great job of trying to keep up with questions as they've come in. Some of them have gone to everyone, and some of the questions have come in just to the host and panelist. So we want to take just a moment to allow everyone to drop some additional questions that you have in the chat right now. And we are going to kind of summarize some of them that have come in so far. And before we do that, I want to just pose one question to the panel just for a conversation to give you a chance to think about what additional questions you might have. And that is, if a licensing agency is just beginning to implement quality assurance strategies, where do you suggest they start? What are one of the strategies that maybe are the easiest for them to get going with as it relates to what was shared today? And I'll open it up to anyone.
Oh, can you hear me, Amy?
We can. Here you are.
This is Pam. I was gonna, and Jennifer can speak to this as well, but I was gonna say that, I think the most important thing is to find out the first step of quality assurance is doing the piece that Jennifer mentioned about finding out what's going on now. Take a look at the rules, do shadow visits and peer visits just to see if you can see how things are being interpreted in your state throughout your state to see if people are viewing things the same way and move from there, and not take it from the perspective of something being right or wrong, like someone's doing it right, somebody's doing it wrong, just more of reaching consensus with all, the consultants in the state. I think that's a really good first step.
Great. Thanks so much, Pam. Anyone else want to chime in on that?
I wanted to just piggyback on what Pam said, and I think what's important in what she said is to really focus on the fact that you're not doing this to identify who's doing it one way versus the other, right? In terms of right or wrong, like there is not necessarily a right way to do this and a wrong way to do this. If you come at it from that perspective, it feels a little bit, icky, I guess, for people, for lack of a better word. But what we've been really clear in trying to communicate with our staff is that we know that inconsistencies exist. We know, providers know that they exist. That's the number one thing we hear from our child care councils, things like that, so-and-so evaluated it this way, and then this person looked at it this way. And so we know that that's a part of that it exists in licensing. And so when you start having the conversations from the perspective of, we're not doing this to find out who's doing a job right or wrong, we're doing this to find out what is best practice for the staff, for the providers, for the children in the programs, and then we're going to address it, in terms of that, it comes across a little bit less threatening, and hopefully kind of gives you a little bit of a foot in the door, at least to have those conversations a little bit more freely and a little bit more openly.
Great. Thanks so much, Jennifer.
I have one more thing, Amy, to that, which is Jennifer, and I will stop piggybacking on each other, I promise.
No worries. Go ahead.
But the other thing is that strong indicator manual. That's another really good place to start, because if you have good policy and you have clear expectations for everyone, for your consultants, and that the providers understand what you're going to be looking for, consultants aren't alone when they go in. They have the strength of the whole group with them, because we have determined what exactly we're going to do, what the process is. And it just gives you so much strength and support if you have policy and you follow it.
Thanks so much, Pam. That's an important point for sure. That was a perfect segue too to a couple of the questions that came in about your interpretive guidelines. And I know Shannon had dropped them in the chat earlier, and then you dropped them in the chat, Jennifer. One of the questions was whether or not they are available on the website. And you noted that they are definitely available and open for the general public to use, as well as the consultants and the providers. One of the questions came in about what was your process for making the interpretive guidelines. The person had noted that their attorney general had actually advised it would basically be rewriting the rules. And then another question related to interpretive guidelines came up and asked whether or not you all have ever been challenged during a legal hearing as it relates to the interpretive guidelines.
In regards to the process, what we did, we literally had a work group that was formed. It lived with, a certain number of consultants doing the work, but it was really a collaborative review for, there was representatives from every unit and region within child care services, and they just met it was not a process that happened overnight. I want to say that process probably in totality took maybe close to about 1.5 to 2 years to get all the way through both rule books, to get all the way through and provide all that information. It wasn't until we had one version out that we actually then went back and merged because we had an indicator manual and we had a core rule reference chart and compliance chart that was a separate document. It took us another several months to then go back in and merge those pieces. So it's definitely not something that it takes time, and it takes, a lot of conversation and a lot of commitment to the group to continue to have what does this need to look like and that kind of thing. In terms of the questions about, the challenged, to my knowledge, I don't know that they've ever been challenged. They are used by our staff as support in hearings and things when, we're asked about a rule or we're asked how we evaluate those kind of things. If anything else, it provides kind of that clear transparency in this is what our procedures are. This is our process. This is how we do it. And so it kind of gives some validity to what, you know, they might be asked in questioning or having to present in terms of, you know, cross-examination or things like that. So.
Great, thanks. There were a few questions I know just kind of on the logistics and the structure of the Child Care Services Division. So I just want to recap those real quickly and certainly chime in if I don't get any of the details right or didn't capture it. But we had a couple of folks ask about how many childcare centers and how many facilities in total, and then homes and centers. And so if you missed it in the chat, there's 3,102 centers-based programs in Georgia and 1,245 family childcare learning homes. So a total of 4,347 current licensed programs in the state of Georgia at this time. Georgia, Jennifer mentioned earlier that there's regional consultants that do the routine monitoring. There's 48 of those regional based consultants. There's 6 regions that each have 8 consultants with coordinator and a manager. And then there's the complaint unit that has 11 consultants. Trying to just kind of categorize the complaint unit. There was a couple of questions on that. And they do have different categories of complaints. There's category 1 and 2, which are the more egregious allegations, and that would be handled by the complaint unit. And then the 3 and 4, categories 3 and 4 would be handled by the regional consultants. The average caseload's about 90 sites per consultant. And I think I captured most of those. One of the questions, Jennifer or Pam, was what is the ratio of staff who are mentors versus licensors? In other words, how many licensors are trained by each mentor consultant? And are those mentor consultants veteran or current licensors?
You may have, if I don't answer a piece of this, Amy, ask me again, but
okay.
We have 5 mentor consultants within the quality assurance team. And those, they're just paired kind of on a rotating basis. In addition, we're also using selected coaching consultants from the regions. And these are people that the managers within those regions have identified as kind of their example setters, for lack of a better word, their mentors as well. They're not so involved in the quality assurance, like the ongoing quality assurance piece, but they assist with the onboarding piece for the staff in those regions. So, you know, we just have the 5 mentors and they kind of go on a rotation basis, depending on how many we have coming through onboarding at any one time. I mean, some of them have worked with, you know, 2 or 3 at a time. As we're moving more into the quality assurance initiative, we're still kind of figuring out what that will look like in terms of numbers. But I mean, my guess would be, it would be probably average of about a region. So you would probably have like 1 mentor consultant to about 8 or 9 regular consultants. Great,
thanks so much. We had another question that was related to whether or not the monitoring visits for subsidy were conducted by licensing staff or separate unit. And so I just want to note for everyone that might have missed it that any licensed programs that are receiving subsidy funding are visited by the regional licensing consultants, and then license exempt programs, there's a separate exemption unit that does the monitoring for those. I know we are getting very short on time. I think probably the easiest thing to do will be to let you all know we're going to have an email address at the very end that you can reach out to the quality center, and it will get to myself or Christy or Shannon or Tatiana, and we can link you up and get you to the right person from the Georgia team. But I just want to take a quick moment to let everyone know about some upcoming opportunities. If this topic really resonated with you, and it seems like it did because we've had lots of questions, we're going to have a follow-up community of practice on May 19th. That's going to talk a little bit more about embracing quality assurance strategies. We'll have some different examples from other states and we'll likely have some Georgia folks on the line too. So there, Shannon has dropped a link in some information into the chat about that community of practice. On June 23rd, we'll also have a license exempt community of practice for those of you that may focus on the license exempt community in your state or territory. That information is also in the chat box. If we go ahead and move on, this is, if you've got your mobile device handy, you can scan this QR code to give us some feedback on today's session. And Shannon will also drop a link in the chat box for the survey. And right before that survey, you're going to see a link also to the licensing professional development series. That link will take you to our landing page where today's slide deck, as well as the recording, will be posted once they go through the remediation process for accessibility. The first two sessions from this year, the first was on balancing technical assistance and enforcement. That is posted there, as well as the one from February on equity. And this one will round it out when those get posted. So that's a great link to watch for. For those of you that have attended the live session today, you'll be receiving a certificate via email with the email address that you registered with. Due to the volume of folks that we had on the line, it will take a little bit of time to process certificates. So bear with us. We will get those out just as quickly as we possibly can. I want to just thanks everyone again for joining us today. Again, a very special thank you to all of our guest panelists for the fantastic presentation and information. We hope to see all of you again for the community practice sessions. You will see there on the middle of your screen now an email address to the Quality Assurance Center if you have additional questions, or if you want to reach out and be connected with any of the panelists from the Georgia Department of Early Care and Learning, excuse me. So again, thanks again, and have a wonderful rest of the day, and take care.